Yes, it's time for another Gobbet Opus from December 9th, 2008. Slow. It is slow. There's a lull between Thanksgiving and Christmas when the hospital slows down. But with the economy in the toilet, the hospitals seem even quieter than expected. You would think the economy would make no difference in how often people get sick, but it does. In part, it's because people don't seek care when they're ill, but tough it out, and, as a result, sometimes die. Hard times mean an increase in deaths from the uninsured, but it will take some time before the unemployed of today become the corpses of tomorrow. It is also, sadly, a slow influenza season. No flu, no pneumonia, no death, no disease. Sigh. I can't speak for other institutions, but this year we have been especially good at getting our employees and patients immunized. So maybe the immunizations are working, herd immunity in action. It's such a pisser in infectious diseases that when we do our job right, our work goes down. It's like tobacco companies telling people not to smoke. Last week in clinic, I saw a patient in their late 70s who had osteomyelitis of the femur as a teenager. It snapped while playing football. 50 years later, the leg pops open and starts to drain. Cultures are growing Staph aureus, no surprise, but curiously it is sensitive to penicillin. Penicillin-susceptible Staph aureus accounts for less than 2% of Staph aureus, or is that Staph aureus? Elvis, Elvi, aureus, aureus. So it accounts for less than 2% of Staph aureus these days. It's kind of like finding a coelacanth, or a caveman preserved and still alive in a block of ice. Having a Staph aureus reactivate after 50 years is not that unusual, and not even the record or my personal record, which is 60 years. And 60 and even 80 years have been reported in the literature. In the era of antibiotics, we rarely get to see a bone infection that festers for decades before becoming symptomatic. So what to do about it? Probably nothing. The only cure would be amputation, and since there is no loss of structural integrity of the bone, it's probably best just to beat it down with a little antibiotic. I once did a back of the envelope, or maybe it was a back of the envelope calculation years ago that suggested that 50 years for bacteria was about the same as 3 million years for humans in terms of doubling time. About 3 million years ago, we were Lucy, a 3-foot-high hominid wandering the plains of Ethiopia looking for a Wii console for Christmas. The Wii has been in short supply that long. I think Wii Sports may be why we evolved the opposable grip. At least that's what I understand. But I wonder if the Staph aureus of today is the same Staph aureus of 50 years ago, or has it evolved enough to warrant being called a new species? I have looked in the literature and asked around, and most people look at me like I'm a lunatic, but that's my baseline. But as best I can tell, no one has ever addressed the issue of how much Staph aureus has changed over the last 50 years in response to medical therapy. Given all the genetic changes in the USA 300 strain of MRSA, the one that's causing our current plague of boils, is perhaps calling it Staph aureus akin to calling modern humans Australopithecus afarensis? I don't know, but I wonder. The relevant references are reactivation of osteomyelitis caused by Staph aureus after 50 years from the American Journal of the Geriatric Society. Recurrence of chronic osteomyelitis and a regenerated fibula after 65 years in the journal Orthopedist. And finally, first occurrence of osteomyelitis 80 years after infection in the Journal of Joint and Bone Surgery, 1951. And that ends our Gobbet of Pus. Pus.